It's a pleasure to be here with you today. My name is Leslie Munoz, and I'm the state representative for House District 22, which is Woodburn, Jervis, Brooks, and North Salem. Thank you for the opportunity to testify today in support of House Bill 4119, a measure that aims to strengthen fairness and access within Oregon's managed care system for injured workers. Workers' compensation should function as a safety net, ensuring that injured Oregonians can access timely, appropriate, and high-quality care. Currently, some managed care organizations, MCOs, plans have contractual provisions that can limit an injured worker's choice of provider or make it difficult for certain qualified providers to participate. HB 4119 directly addresses these barriers by ensuring that no certified MCO plan can discriminate against any willing provider within its service area, regardless of what the provider's professional designation or affiliation. This provision will protect worker choice and increase provider participation in workers' compensation networks. When injured workers have greater access to competent and willing providers, they have a stronger chance of returning to work sooner and with better health outcomes. Removing discriminatory barriers also supports fairer competition in the healthcare marketplace, which can improve access, especially in rural or undeserved areas. Importantly, HB 4119 expands the definition of who may serve as an attending physician to include nurse practitioners, physician associates, chiropractor physicians, and naturopathic physicians for the purpose of treating workers' compensable injuries. I'm sorry, I'm distracted. They're calling me from the floor. These professionals are highly trained and often primary points of care for many Oregonians. Their inclusion reflects a modern, team-based approach to healthcare that recognizes the value and expertise of all licensed providers, or that all licensed providers bring to injury treatment. This change will help ensure that injured workers can see the appropriate provider without unnecessary referral hurdles, and that they can benefit from culturally competent care delivered by providers with strong community ties. Our workforce depends on workers' compensation system that is fair, accessible, and responsive. By preventing discrimination in managed care contracts and broadening who can serve as an attending provider, HB 4119 takes important steps towards these goals. I urge this committee to support HB 4119. Thank you.
Thank you, Rep. Munoz. Do we have any questions before we allow Rep. Munoz to get back to the important business? Patrick.
I don't have a question. I just have a comment. I want to thank you, Representative, for taking the time to present before MLAC. It really means a lot to have a representative take their time and come from the floor in your important work. Thank you.
Thank you. I appreciate that. I guess I have a question, if that's appropriate. I don't know how MLAC works.
No, please. Yes, of course.
Yes.
Ask away.
So what is the process of me knowing where my bill sits with MLAC after this meeting?
I will let Terry jump in if I'm incorrect on the analysis, but typically, as bills are drafted and are in the pipeline, they take a quick stop at MLAC for if they are within our purview. We then make a recommendation either to support or not support based on testimony and stakeholder engagement. As soon as we have a determination there, we draft a letter signed by the two co-chairs kind of indicating what action, if any, was taken, and get that submitted back to the legislature and typically the committee and the proponents.
Okay, well, thank you very much. Thanks for having me. And I'm sure we will meet again because I'm on the Labor Committee and then also on healthcare. Thank you so much for your time.
Great, thank you. We appreciate it. So having that testimony, we're going to pause. We will go back to any potential motion on HB 4040. Apologies for shuffling things around. I just wanted to make sure that we're being mindful of representatives' time. I see Emily has her hand raised.
Hello. I move that MLAC approve HB 4040 with the -19 amendment.
We have a motion. I see Kim has her hand up.
I second the motion.
We have a motion and a second. Do we have any discussion? I see Sarah.
Thank you, Co-Chair Strickland. I just wanted to state that I think this is an exciting time to address access to care and the issues that have been before us with access to care. So I'm looking forward to this moving forward. And I would like, when that is addressed at some point in the near future, to retake up the conversation at the MLAC level to end open-ended time loss. Thank you.
Thank you, Sarah. I hear you on that and want to reiterate, I know that we had a commitment from labor a long time ago to continue in discussion of that concern. And I want to restate that we are committed to kind of upholding our end of continuing that work and discussion. So appreciate that. So we have a motion, a second, some discussion. Do we have any other discussion? Seeing none, all those in favor signify by saying aye.
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 Any opposed? Seeing none, any abstaining? Okay, the motion passes. Switching back to HB 4119, I know that we have Rep. Munoz's testimony. I see also Dr. Sabo listed as signed up to provide testimony about the bill. Is Dr. Sabo available? I see you there, Dr. Sabo. Please take it away.
Yes. Our focus should be for all stakeholders to ensure that organ injury workers receive timely access to evidence-based, safe, effective, and respectful management of their on-the-job injuries. You heard what 4119 does, and I'm not going to take up the committee's precious time. We were anticipating the summer interim task force meetings to review the facts, drill down through data and the medical evidence relative to do those support removing the restrictions on physicians' assistants, nurse practitioners, physicians, chiropractic physicians, naturopathic physicians. Is that in the best interest of injured workers receiving and prompting them to get access to timely, effective, evidence-based care? And so I look forward to those meetings, and I urge your aye vote on 4119. Thank you.
Thank you, Dr. Sabo. Do we have, I see Evo has a hand up?
Yeah, thank you, Mr. Chair. And my apologies, I didn't technically sign up to testify, but I submitted written testimony, and I will keep it short and refer to the written testimony on the record and post it to the MLAC's site. SAIF opposes House Bill 4119. Basically, I will summarize 3 points here, and then there's more in the written testimony. One, we oppose it on the limitations to the MCO. I want to echo Ian Klein's comment from at the beginning of the meeting. It is not in the best interest of the system or in the delivery of quality care. Two, I want to point out chiropractors can already serve as attending physician for the first 60 days or 18 visits, after which there's a scheduled transition to another attending physician who may or may not approve continued ongoing chiropractic care, depending on the case and the best interest of the worker. And three, we are in the end concerned about costs. We looked at all claims and compared the same kind of type of claims where chiropractor serves as attending physician for the first 60 days to when another provider, any other provider, serves for the same 60 days. Over the life of the claim, the total medical cost and the total physical medicine costs are always higher when an attending physician, when a chiropractor, serves as AP. And we are concerned that should HB 4119 pass, that this would just mean an increase in costs to claim costs, impact employer premiums. And I want to remind people, and I don't think I need to remind people, but you just approved a bill earlier today that will increase costs. There's got to be a limit, and we are concerned about that. For all these reasons, we oppose the bill, and we respectfully ask that MLAC also oppose the bill. Thank you.
Thank you. I see Kirsten and then Thais.
Thank you, Co-Chair Strickland. I am in the same boat as Evo. I apologize for not signing up for testimony, but did want to offer EGC's perspective on this. As you just heard from SAIF, a lot of our members are insured by SAIF, and so obviously their concerns become our concerns on a lot of these issues, but particularly the cost implications that he was discussing. I see the importance of having conversations around access to care and making sure that everyone is able to get the care they need within the system. I do have concerns, however, looking at what SAIF has pulled and discussed in terms of cost implications to this particular change to the system. I also agree with the comments brought forth by Ann Klein earlier about concerns that about the control over MCOs and not allowing them to have what they need or the discretion that they need. I know that talking about MCOs has been a piece that's been on the MLAC work plan. So I think if that is a concern that MLAC wants to dive into, I think that talking about it through the work plan and then figuring out what the best solution is, as opposed to making a change without a deeper conversation at MLAC. So thank you for the opportunity to give our perspective. And we would second SAFE's recommendation that MLAC not move this forward at this time. Thank you.
Thank you. I see Thais and then Dr. Sabo.
Hi, Thais Lomax with Sedgwick. I apologize. I'm having some camera issues this morning. To keep it short, we have evaluated similarly to SAIF those outcomes and costs with chiropractic care, not just within the state of Oregon, but actually nationwide, and have come to similar findings. We concur with both SAIF's statements and with Ann Klein's concerns that were expressed earlier today with this bill.
Thank you. Dr. Sabo?
Yes, thank you. In response to Evo's comments and also Ms. Klein's comments relative to the MCO's open panels and the system working currently, I will use Majoris as a perfect example of how it is not working respectfully in our opinion. Majoris's MCO panel in the Woodburn area, there isn't a single chiropractic physician on panel in Woodburn, Turner, Silverton, or Molalla. Of the 16, I would say there are 16 or 18 providers, other types of providers listed. We did our research, only one individual actually will accept workers' comp cases on their panel. That's a nurse practitioner in Woodburn. As to costs, we've heard repeatedly the supposed data from SAIF Corporation. I met with Evo and Elaine before the 2005 session. I presented them with 87 pages of peer-reviewed journal medical articles showing the outcomes and superior cost savings of chiropractic care. And relative to nationwide statistics, I would refer you to the Workers' Comp Research Institute. Now, the Workers' Comp Research Institute is an independent, nonprofit research organization providing objective, peer-reviewed data on workers' compensation systems. It's considered the gold standard for analyzing public policy, medical costs, and outcomes for injured workers. It does not take positions, but rather supports evidence-based decision-making for policymakers and stakeholders. To that end, until 2021, the Workers' Compensation Research Institute performed a study on the chiropractic management of injured workers. This was a study of 2 million claims across 28 states. Their conclusions were it resulted in a 61% lower cost overall when injured workers treated exclusively with a chiropractic physician. Case average was $1,366 versus $3,500. Time loss with chiropractic physicians managing the case was an average of $492 versus $3,600. 1% of the chiropractic patients at some point received an opioid versus 10.3% for other healthcare providers. And so we would argue that SAIF Corporation's data referring to, and I'm looking at a January 14th email that Representative Rob No sent to me that in the subject line said feedback from MLAC. His first sentence was, here's what we heard back from MLAC, when in fact, this is a document from SAIF Corporation. In that document, it cited that the average visits for a chiropractor was more 10.5 over 60 days versus 5.4 visits to other provider types, MDs, PAs, nurse practitioners, and DOs. And we would tell you that the 5.4 visits to the other providers does not constitute hands-on treatment. It is in fact for consultation examinations. And generally those providers prescribe medications and or a course of physical therapy, usually both, and those are direct medical costs. And so the question that I would have for EVO and SAIF Corporation, what is the average claim cost for physical therapy prescribed by one of these other healthcare providers? Our research by the same Workers' Comp Research Institute suggests that it is between $4,000 if they get the physical therapy within 3 to 7 days. If it's delayed to 60 days, that same physical therapy case averages slightly over $5,000. Thank you for your time.
Thank you, Dr. Sabo. I see Ann Klein has a hand.
Hi, yes, sorry, it took me a minute to get off of mute. I just wanted to respond to Dr. Sabo's comment regarding Majoris's panel limitations. And we do recognize that there are certain areas of the state where we have maybe not as robust of options as other areas of the state. I have a provider relations team where their responsibility includes both proactive outreach to providers of all specialty types to address those limitations where we can. In 2025, of those that we proactively reached out to, oftentimes because we saw past experience in treating workers' compensation or in treating an individual that was enrolled, and perhaps we had opportunity to partner with them in the come-along privilege provision, we reached out. Only 18% responded with openness to contracting, and of those, 4% ultimately resulted in agreeing to contract. There's certainly more limitations than just willingness to treat workers' compensation. It's also how it aligns with their overall practice and the availability that they have and what they're seeking to focus. In addition, we also regularly receive inbound membership applications for consideration of network participation. In 2025, we received 84 applications from all different provider specialty types. 56 of those we extended contracts to, specific to the chiropractic specialty. Of those 84, 20 were from chiropractors, and we are in active contract discussion or executed contracts with 17 of those.
Thank you.
Thank you.